Hey, what's up? It's me again, Dr. Josh, and today we are talking about how to build trust with your patients, and we're talking about research. And this article, one of my favorites, is called "Is It Me? The Impact of Patient-Physician Interactions on Lupus Patients' Psychological Well-being, Cognition, and Healthcare-Seeking Behavior." This is the textbook on how to not treat your patients like garbage. Incredible information here. Unfortunately, some stuff that'll frustrate you. So one of the things that they do is they talk about examples from those patients of positive healthcare experience and negative healthcare experience. And I just want to discuss that. Some of this can be solved with technology, and that's what we do at TrustDrivenCare. We help implement the technology to provide a growing trusted relationship with all your patients, right? Build your office up, grow your impact in your community, and help patients have a better experience. Some of the stuff in here cannot be addressed with technology. I'll be completely honest. You got to be a good doctor. You got to be a good nurse. You got to be a good provider, right? So number one, in the area of the diagnostic appointment, positive experience that some patients talked about. I think we can learn so much from this and how it will impact us going long-term and how we talk to our patients. But the diagnostic appointment, positive experience. Everyone was so compassionate, and I was sent away with a lot of information. The rheumatologist made it as bearable as it's ever going to be. I knew I was in safe hands. That amount of information is huge. That can be solved with technology. We'll talk about it later, but that's a positive experience. Negative experience. Again, this is at the diagnostic appointment. The rheumatologist said, "You've got lupus and arthritis," and that's it. The patient was sent away, and the patient says, "So I went away and Googled it, and all I found were bad stories." I was like, this is it. I'm going to die. Even though it's been 4 years, I didn't know anything. I didn't know what lupus was. And I think they just didn't care that much. And I think that's so telling that the patient said, that's it. I'm just going to die because they Googled it. Because instead of the provider giving the information that's important and based on the diagnosis, you let that patient go to Google and it's overwhelming amount of bad information and it's scary as hell. So, all right, number two. Again, going positive and negative. We have the availability in times of crisis. Positive experience that a patient talks about. The doctor said, if you need me, just email me. And the patient said, it's priceless because you never know when a flare is going to strike. You could be doing cartwheels today, tomorrow, you can't even move. So to have that lifeline to say, doc, I'm in trouble is huge. All right. And even faster than email would be, again, technology, SMS messages, text messages, as we call them, right? Just, hey, do you have an appointment at 4:15 today? I'm hurting. Negative experience and regarding availability. The secretary, the front desk, ended up saying, I refuse to take your phone calls anymore. If you've got anything to say, you'll have to phone the rheumatology hotline. And the hotline nurse said, we can't keep replying to your phone calls. You're not the only patient we speak to in a week. I'd urge you not to call again. Man, can you imagine that? Can you imagine here you are hurting from lupus or you have an autoimmune disease and being dismissed by both your doctor, who tells you to call the hotline, you call the hotline and they say, stop calling. Can you imagine if that was your mother, your wife, your daughter, your partner, whoever it is, seeing somebody get treated like that in the healthcare system is, for me as a healthcare provider, is absolutely embarrassing. And it's frustrating for me as somebody who cares about people, right? So that's the negative side. Can that be solved with technology? I think one thing there, they're saying, we can't keep replying to your phone calls. You're not the only patient we speak to. Again, I'll go back to the research on the sales side and marketing side of the world that found that text messaging can handle 60 to 80 active conversations in an hour, whereas phone calls, you can only handle 10 to 12. I think it's 10 to 12 phone calls. So if that hotline was a text-based hotline, they'll probably be able to handle a lot more information and can send links and whatnot that you can't send in a phone call. Those links could be further information, videos, things like that to watch. Anyways, all right, next up, belief and validation in the patient's symptom reporting. Positive experience. This is great. The rheumatologist sat there and listened. There was no questioning my experience. It was accepting of my experience, right? Or another one, the rheumatologist was so caring and gentle, he would look at you as if you're the only person who existed for your entire appointment, and what you were saying was totally valid. I felt safe with him. Now that cannot be replaced by technology. That is an empathetic human being empathetic. There is no replacement for that. So you can use technology to get everything off your plate so you can be that person who's so involved and so intent looking at your patient during their visit. But man, they hit it out of the park there, right? A negative experience is this disbelief and dismissal where the rheumatologist said, you walked in here unaided, your hands aren't deformed, appointments are allocated according to need, and the patient said every symptom I had that wasn't my joints, he dismissed as being nothing to do with my autoimmune condition. And this patient is talking about fatigue and depression. Come on, that is a joint problem. Joint problems produce depression all the time. As a chiropractor, you see that in back pain all the time. Why won't they listen to me and what I'm saying? And why is he ignoring my neurological symptoms? They're looking at their computer screen instead of looking at me. You got to be present. You got to be present to increase that trust and make that huge impact. So that's the negative. All right, positive experience is care, the holistic care, continuity, communication, and consideration for quality of life, not just focusing on the disease, but rather the quality of life of the patient. Positive experience. I think this is huge. My rheumatologist has these patients fill out a questionnaire on symptoms. She wants to know how you are really doing. She discusses this and other concerns as the perfect combination of analyzing clinical test results, factoring symptoms, and asking pertinent questions. She asks at every appointment about the fatigue, brain fog, and quality of life and gives practical advice. Oh my gosh, you got to be present and ask the right questions. Now, surveys, sending information, all that can be solved with technology. If you're interested, check out TrustDrivenCare.com. We have the tools and technology to allow you to do that. But in general, it's so important to be a present doctor and ask the right questions, have people fill out the right forms, and then take action on it. Negative experience says the quality of life is the problem I want to address and get sorted. I'm not really interested in some of the things that the rheumatologist really is interested in. It's the fatigue that's ruining my life, and he's purely interested in the disease. You'll hear this over and over in all forms of medicine where we as doctors focus too much on the diagnosis and not on the person. Who is paying your bills? Who is coming in? Who needs care? It's the person, and one part of that person is the disease, but it's not the whole part, right? So that's a negative experience. It's so frustrating, and the fatigue and pain are unquantifiable, as in that patient can't describe it to the doctor to get belief. So are you stepping back? And I'm guilty of this too. We got to step back sometimes as providers and say, I know this is your diagnosis, but what does life look like? What is this affected that is going to change or influence your life? I treat low back pain all the time, and I forget, low back pain gets in the way of childcare. It gets in the way of having a clean house. It gets in the way of sexual intercourse. It gets in the way of feeding your family. All those things detract from that quality of life, and all those things are important to focus on and give people some guidance through there. What can they do, and where should you really watch out? So I'm going to continue to focus on what I learned from this article. Pretty amazing. Again, Sloan and Naughton, titled "Is It Me? 2020 in the Rheumatology Advances in Practice." Check it out. It's well worth the read. It's a heavy article. It has tons of great information. If you are interested in having a better technological approach to your office where we help you communicate better in the way that patients want to be spoken to, then check out TrustDrivenCare.com. We have the tools, the software, and the education around how to improve. I think there's a lot of improvement we can make in healthcare, but it all starts with communication. Without that, we got nothing. So we're interested in helping you do that. Check us out, TrustDrivenCare.com. I hope this was interesting for you. Thanks.